طيب الآن تفضل.
Assalamu alaikum. I'll use this one. Thank you for your presentation. And I just wanted to introduce Dr. Fawzi Al-Odeh. He's his spiritual care, palliative department at Prince Sultan Riyadh Medical City in the Riyadh Military Hospital. He's a principal clinical psychologist and spiritual counselor at Riyadh Military Hospital.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين. صلى الله وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين وبعد. I'd like to thank you for having me here today to address you about spirituality in the palliative care. I do have a nice lecture, and it's on my flash memory, but I have one problem. If I start my lecture, it will not take 20 minutes. It will take more than that. Then I decided, if I stand here before you, and I want to amuse you, what is it that I can say that at least I can guarantee that you will be awake for the next 20 minutes? It has to be stories of things that happened throughout my working years. I'm going to start with this lady. She's 47-year-old, palliative. There's one issue with this lady. When I saw her, she had the bottle of water against her chest like this, and she won't let go. The palliative team could not, actually they failed to convince her to continue taking the medicine. They couldn't understand what's happening in the lady's she would not speak about it. They asked me to see what's going on with this lady. So I come to her. Assalamu alaikum, wa alaikum assalam. Normally Saudi ladies, when they see a man mahram, they don't speak to him in a direct way. So she was like giving me her back and she was talking to me in an indirect way. I said, would you like to hear me read the Quran? Right away she looked at me and she said, yes, I would love that. Then I recited the best recitation that I know of. يعني جملت صوتي لها. I can see that she was weeping. She was in tears. Then I stood up, I said, if you want to discuss the issue, I'm busy today. If you want me, I can come back tomorrow. She said, yes. Then I said, what is the proper time for you? She said, same time. 11 o'clock, second day, I was there. Assalamu alaikum, wa alaikum assalam. Do you mind if I grab a seat and sit next to you? She said, go right ahead. So I sat next to her and I said, what's going on? We have an issue here. We're not taking medicine. That's a problem. This is not a hotel. This is a hospital. No medicine, you have to go home. So she said, how could I take their medicine? I said, what's wrong with the medicine? She said, how could I eat their food? I said, what's wrong with the food? Now she's talking about obsession. She's afraid of things. She believes that the chronic disease that she has, that's enough for her. But in order to get by infection, another disease, an extra disease, this is not what she wants. But I had to convince her that she can, the IV is good enough for her. And it doesn't have to be food. What is it? What is the IV? She asked me. I said, we give you food through your vein. She said, my left arm hurts me. Is it okay with the right arm? I said, sure. In 1 hour time, the IV was there. She was happy. The palliative team was happy too. It's how you deal with these patients. Palliative, what does palliative mean? You came to a palliative cancer, what does it mean? Does anyone here tell me what does palliative mean? ليس باللغة العربية What does palliative mean? Huh? Yes? 5 dinar. Yes? Sorry? It's not mentioned in the book? What? Complementary? Okay. But if somebody tells you that this patient is not on an active medicine, what does that mean? There's no treatment. What does that mean? يعني كلميني بالفلاحي. What does that mean? يعني she's almost dying. That's what it means. It's the final stage. So, if any palliative team offer their services to you, do you like that? If somebody tells you that your mom is no longer on an active medicine and we need to bring the palliative team in, does that make you happy? It should, because it's not active anymore. She's no code. DNR, that's what they call it, DNR. DNR means do not resuscitate. So she can't have an active curative medicine, but she has to be now on a palliative stage. So it's a final stage. It's a good thing. We do have palliative support for the patients. And that's, alhamdulillah, thank Allah Azza wa Jal, that it's found in the Islamic region, in the Arab region. We need this support to our patients. It's been discussed that the pain, it divides into physical, mental, spiritual, and also social. And they say if you know the pain, the place of the pain, that means you have to know how to treat this pain. So if you find a spiritual pain, you need a team that can deal with an issue like this. There's one patient, 17-year-old. His main concern was to become a soccer player with Al-Hilal. Al-Hilal is a Saudi team. Al-Hilal means blue color. So you can tell when you walk in his room that everything in the room was blue. So he's Hilal. Cannot be yellow because he's not Nasrani. So he was in love with this team, and his main goal is to become part of that team. Out of the blue, in the morning he woke up, where he found out that he only had one leg. He did not sign any papers that says he can operate on me. But the father kept the knowledge away from the son. And he told the doctors, do not tell him. Then the father signed. Now the son woke up in the morning, there was no leg. So what happened to the dream? There's no more dream. He cannot be a soccer player. So what do you think the son acted? 17-year-old. Do you know how he acted? Whoever entered his room, he was an impatient. He will hit you with something. He's ready. He became aggressive. So no nurses could enter the room because he's very aggressive. The father stayed outside the room 3 days crying because he cannot see the son. And the son made sure that that he will not see the father until the moment of death. So they called me in. There's a role that we have, and we have to play it right. And if you don't play it right, you might just do a bigger mess. So I opened the door with something in my hand. What's this? I don't know what this is. I went like this. So he said, "Ish hada ya Sheikh?" I don't know. You tell me, what's this? Are you aggressive? So am I. Then he smiled. He said, "Ma alayk ant." No, I will not hit people like you. I said, "Okay, can I come in now? Am I in peace?" He said, "Sure." So I sat with him. For 60 minutes, I'm trying to explain to him that suppose your father's decision was wrong. But have you discussed it with your father? He said, "Sheikh, I'm not angry with my dad because they chopped off my leg. Shouldn't I be consulted for this? This is my leg. Somebody should have told me that I said, what if they told you? What would your answer be? You tell me now. Would you say go ahead and do it? The answer is not. You will not allow that because they know how you think. You're 17. So if you were my son, probably knowing you, I might just do it behind your back, knowing that probably I might save the rest of the body. So I said, do you mind if I allow your father to enter the room? Now, entering the room, it's a different scenario. To me, these father and son, they just met. They don't know each other from before. It seems like the father took a long journey, so all of a sudden he sees the son. You can imagine the amount of tears that I have seen in 5 minutes. They were hugging each other. They won't even let go. That's how warm that meeting was, 5 minutes. And I was just standing there, looking down, and I'm giving them the benefit of the doubt. This is a private moment, a quality moment. They have to live it up. And they have the right to do that. So after that, we sat down as a family now. I'm the consultant, spiritual advisor, trying to wrap up closure for this meeting. I asked the father, how do you find your heart? He said, he's my son, I love him so much. I asked the son, how do you find your heart? He said, I love my dad so much. I said, do you forgive each other? They said, yes. 5 days later, the son passed away. Now imagine if the son passed away, not allowing the father to see him. I hate to be that father. I hate to continue, I hate to be in his shoes, to be truly honest with you. How hard it is to not see your son in his final days. This son, in his 30s, he was in grief, he was sad. What's wrong? He said, my mom doesn't know I'm having cancer and she's in a different town, and I told her that I'm just going on a long travel and here I'm in Riyadh, I'm treating, I would love to see my mom. Okay? Where's your mom? So he said the city name and we got the number. Contacted the mother. We managed to bring the mom to the hospital. It's not us who will tell the mom what's wrong with the son. This is his moment. So, Mom, would you forgive me? What are you doing in the hospital? Mom, I'm having cancer. What? I'm having cancer. And late stage. I don't understand what late stage is. Mom, I'm dying. The mother doesn't understand. When the son left the house, he was healthy, he was okay. What do you mean you're dying? I don't understand. She said, but you made my day coming to see you. Trust me, our job is not that easy.